Josh Haskell has details on a new directive for these paramedics. Josh?
Yeah, David, for weeks, ICU capacity in LA County has been at 0% today. We checked in with two paramedics who work here at Fire Station 68 in Mid-City to see how they're adjusting to the new directives.
Tanya Crabbe has been with the Los Angeles Fire Department for 12 years, a paramedic for 4. Crabbe says the job has its challenges, but our current COVID-19 surge has her hanging on by a thread.
It's a tremendous amount of pressure. I only have so many resources with my knowledge and my experience and my certifications, and most specifically my equipment I have on my ambulance. But if the hospital's unavailable, I just don't have the resources that patient may need. They need a doctor. They need a hospital bed to be tested or to be taken care of. How do you explain that to the patient? They don't understand that. How do you explain that to the patient's family when you're looking at them and saying, I'm sorry, I can't help it. I only have so much I can do for you at this moment.
A new directive to LA County paramedics has advised crews to cut back on their use of oxygen and refrain from transporting patients with virtually no chance of survival. If a patient is in cardiac arrest, ambulance crews should not bring patients whose heart stops beating. That goes for severe trauma patients, car accidents, shootings, stabbing victims who can't be resuscitated at the scene. Why? Paramedics like Crabbe and her partner Jessica Jackson have found themselves waiting in hospital parking structures with patients for hours.
My patient is sitting on my gurney, and we have to wait for 2 to 5 to 6 to 8 hours with that patient. That hinders us from being out here in the field.
The public is also being urged to only call 911 if it's a true emergency that requires hospital transport. Crabbe says not every COVID-19 patient needs to go to the hospital.
If you're having the flu, call your doctor. Talk to your primary doctor. They're very knowledgeable on everything that's going on. The emergency room is not the place to get COVID-19 testing.
Rob Lawrence with the California Ambulance Association says the new directives are needed, but don't change things dramatically.
Treatment in the back of a moving vehicle is sometimes challenging, and that it could actually make the patient less viable when they arrive. And so the protocol to treat in place, on scene, until you get a result is actually a technique, a tactic, and a procedure that's already carried out in the rest of the country.
Hospitals can pull off miracles that ambulances cannot, but they need space to do so. And that's why these new directives have so many seeing what 0% ICU capacity looks like. Live in Mid-City, Josh Haskell, ABC7 Eyewitness News.